because we can only control the process, not the final outcome. And the problem is lots of patients don't understand enough about the process. They're so used to listening to what the teacher tells them when in school, and so used to listening to what the professor tells them when they're in college. Now, this doesn't mean that I'm wishy-washy or I don't know what to do. Counseling IVF patients can be extremely tricky because the reality is patients crave certainty. They want an expert who will tell them what to do because the guy is an expert and you're paying him so much money as a consultation fee. So shouldn't he know what to do and why to do it? The reality is that good doctors understand that there is no certainty in medicine. There is no black and there's no white. Everything is shades of gray. And this is especially true in IVF, which is elective treatment, and especially true because the process of embryo implantation is not a process which we can control. So while we can provide high quality IVF medical care, we cannot be sure about what the outcome can be because we can only control the process, not the final outcome. And the problem is lots of patients don't understand enough about the process to even be able to differentiate whether the process was good or not, because all they can do is judge by outcome. And this is why they really want a doctor. They want a doctor who's paternalistic, who will tell them what to do. And that's the way most medical training in India, unfortunately, is. And that's the way most patients have been socialized and conditioned. They're so used to listening to what the teacher tells them when in school, and so used to listening to what the professor tells them when they're in college, that they expect to be told by the doctor what to do. That's not our style at all. We're very non-judgmental. All our counseling is very non-directive because we understand that there are 100 different answers to one particular problem. And that's very important for the patient to own the decision. So we spend a lot of time counseling the patient, respecting the patient's preferences, and allowing the patient to make up their own mind. Now, this doesn't mean that I'm wishy-washy or I don't know what to do. It just means that I respect my patients enough that I will allow them to make their own decision for themselves. I will not let them make the wrong decision, but when they have choices, I will insist that they choose.